Basic anatomy. Urinary system. Main function. Removes metabolic waste and regulates fluid and electrolyte balance. 1. Main components. Kidneys. Filter blood and produce urine. Ureters. Transport urine from the kidneys to the bladder. Bladder. Stores urine temporarily. Urethra. Transports urine out of the body. 2. Clinical application. Urine test to detect kidney infection or disorders. Kidney ultrasound to detect kidney stones. Detailed explanation of the urinary system. 1. Main function. The urinary system is responsible for waste excretion. Removes metabolic waste such as urea, creatinine, and uric acid from the blood. Fluid and electrolyte regulation. Controls the balance of water and ions such as sodium, potassium, and chloride. Blood pH regulation. Ensures the acid-base balance of the blood. Hormone production. Produces erythropoietin, stimulates red blood cell production, and renin, regulates blood pressure. 2. Main components. 1. Kidney, ren, structure. Bean-shaped, located at the back of the abdominal cavity, retroperitoneal. Consists of cortex, outer layer containing nephrons, functional unit of the kidney. Medulla, inner layer containing renal pyramids. Renal pelvis, place where urine is collected before being discharged into the ureter. Nephron, functional unit of the kidney that filters blood. Consists of glomerulus, capillaries where blood is filtered. Bowman's capsule, holds filtrate from the glomerulus. Proximal tubule, reabsorbs water, glucose, and ions. Loop of Henle, helps concentrate urine. Distal tubule, makes final adjustments to electrolytes and pH. Collecting duct, carries urine to the renal pelvis. 2. Ureter, a tube-shaped tube that carries urine from the kidney to the bladder using peristaltic movements. 3. Urinary bladder, a hollow organ that functions to temporarily store urine before it is excreted. Normal capacity is around 400 to 600 milliliters. 4. Urethra, a tube that carries urine out of the body. In men, the urethra also functions for ejaculation. 3. Urine formation process. 1. Filtration, occurs in the glomerulus. Blood plasma is filtered, producing a glomerular filtrate containing water, glucose, amino acids, and ions. 2. Reabsorption. Essential nutrients and most water are reabsorbed in the proximal tubule. The loop of Henle absorbs water and ions to regulate urine concentration. 3. Secretion. Waste such as hydrogen ions, ammonia, and creatinine are secreted into the tubules. 4. Excretion. The urine produced is collected in the renal pelvis and excreted through the ureters. Bladder and urethra. 4. Regulation of the urinary system. Hormones. ADH, antidiuretic hormone, reduces water excretion by increasing reabsorption in the collecting duct. Aldosterone increases sodium and water reabsorption in the distal tubule. ANP, atrial natriuretic peptide, reduces sodium reabsorption to lower blood pressure. Blood pressure. The kidneys regulate blood pressure through the renin-angiotensin-aldosterone system, ROS. 5. Clinical application. 1. Disorders of the urinary system, kidney stones. Precipitation of minerals that form crystals in the kidneys or ureters. Urinary tract infection, UTI, bacterial infection of the urethra, bladder, or kidneys. Kidney failure, inability of the kidneys to filter blood effectively. Nephrotic syndrome, loss of protein in the urine due to damage to the glomeruli. 2. Diagnostics. Urinalysis examines the composition of urine to detect infection or metabolic disorders. Kidney ultrasound views the structure of the kidneys and urinary tract. Kidney function test measures the levels of creatinine and urea in the blood. 3. Treatment. Dialysis replaces the function of the kidneys in filtering blood. Pharmacological treatment. Antibiotics for UTIs are diuretics to treat fluid retention. Kidney transplant for patients with chronic kidney failure.